Hi, Daniela here with Anew Med Spa, and we are going to do a Sculptra treatment today on Connie. Connie in the past had a total of 5 Sculptra treatments, and this is her maintenance vial that she gets once a year to keep those collagen results going. So we're going to do Sculptra in the anterior lateral cheek, the preauricular region, jawline, a little in the nasolabial fold, and then just a little bit down here as well where we get a little hollowing around the chin. So we're going to get started. We'll just do our little twisteroo just to get it moving into the syringe. And I'm going to start right out here for the first one. First little poke. Before we started taping, we did alcohol her face, we did the Hibiclens. She numbed for a good 10 minutes. So we're going to do a little anterior cheek. I like to lift this up and just kind of go right under here. And before I inject, I'm going to aspirate, make sure I'm in a good location. Nice long thread, go back, aspirate, and there we go. And I always do a little rub down just to get that lidocaine in the tissue. That makes this injection a lot more comfortable. Go ahead and turn a little bit. Yep, I'm just going to go right out here in the lateral cheek. You're going to help the contour of the cheek here. So I'm just going to pick up the cheek, pick up that muscle, go right on top of bone, pull up before I inject, make sure we're in a good plane. And right now, I had a little bit of a clog. It's giving me resistance, which can happen, so I'm going to pull out, and I'm going to switch my needle. This is just what happens in the real case scenario. So I never want to try to push that in. I will take a new needle. I got it. Thank you. So we know Sculptra is very sensitive. And so if it's going to give you that resistance, just put a new needle on it and try again. Again, deep injection. And now we're good. All these little particles of PLLA, and you got a very fine tip needle of a 25 gauge. This is a 1.5 inch needle, so sometimes clogging can get a little bit more in a longer needle. So it can happen. All right, thank you all. And then I'm going to go preauricular. I'm just going to grab right down here. These are a little bit more sub-Q. So pull back, aspirate, and then do a nice long thread. Come back up right next to it, almost like a parallel thread, and go right next to it. There you go. And that's going to always give a little bit more lifting effect on the jawline and kind of help pull things back. And we do these in 1 ml syringes just because it's an easier flow to go into the tissue. I'm going to devote all those to the rest of the other side. This we're going to put a little in her nasolabial fold. Come back this way a little bit, yeah. So that's the length of my needle. I'm going to go right here. These are pinchers. Aspirate just a little bit. I usually just do half of this. I fill my syringes to 0.8, and so that was 0.4 just in that space. And then turn again this way. I'm going to go right along this jawline right here. So Sculptra, you do have to go kind of fast once you're injecting, just so it doesn't again stick and get stuck. And whenever it gets stuck, you stop and you put a new needle on it. You don't try to push it in. Good. So now I'm going to go to the other side and do those same things. Doing okay?
Yeah.
Okay. All right, I'm going to go right in back into our cheek here. She's got gorgeous cheeks. We're just preserving them. Everyone wants these cheeks. Good. And it always looks like a lot when you put it in. It's all that extra little bit of fluid, and it goes right down. And we're going anterior cheek right here. I'm going to pick up that muscle. A little deep poke. And again, since we're close to that infraorbital foramen, always want to aspirate. Always feels a little funky in that location too. And then when I move my needle, I got to make sure I stay below the orbital rim. So sometimes you can put one finger up here and just kind of make sure your needle's staying under that orbital rim. If you're not sure, just to play safe. And then we're going to go lateral here again for the contour. This is again more sub-Q. Back here. Good. Turn a little bit more. I'm going to do this preauricular region. Here we go, sub-Q area. Good. Thank you. And sometimes people, if they're hollow in the lower cheek region, you can do like a mattress, some lattice threads of Sculptra down here. She's very nice and full down here. We don't need that. So you do want to customize your treatment. I'm going to do a touch in her nasolabial fold just because we all like to get hollow there. She's not, but obviously we're just preserving it. Just a touch on this side. And then again, that jawline, you're going to turn. I'm going to go right over here. She's so nice and tight back here. Let me get this out of my hand. Okay. So I'm just going to sub-Q. You don't need to go under muscle here. And then we're going to give a thread. You can veer up a little bit. Again, aspirate each time before you inject. And then you're going to rub that in. Good. Okay, good. And then that little hollowing area here, this is going to be supraperiosteal. These have to be deep. These are a high-risk area for nodules, an area that with lots of movement around the mouth. We always want to be deep and just a little. Don't overcorrect. So I'm just going to feel her mandible. I'm going to go right on here, more at a 90-degree angle. And then I'm going to aspirate. And I'm going to put a little bit right there. And same thing on the other side. Good. Okay, looking good. So I'm going to just add a little bit more back here. I'm going to have you turn just for more tightening in the preauricular, because everywhere else is looking excellent. And then this last little bit will be for this side. And we always tell our patients they've got to do lots of massaging. When this is done, I'm going to do her first massage because that's really important to make sure everything is spread really well. And then she's going to massage 5 times a day, 5 minutes each time for 5 days. And as you can see, not a lot of bleeding, okay? When you're in the right areas, you shouldn't get too much bleeding or bruising. And that is our Sculptra.